Have you ever noticed dark patches on your skin and wondered what they are? They could be a common skin condition known as hyperpigmentation. Welcome to Channel Health and Alerts. Hyperpigmentation is a term that describes skin that darkens compared to its natural color. These patches of skin discoloration can develop anywhere, but they're most often seen on sun-exposed areas like the face, neck, chest, tops of the arms, hands, and shins. Depending on your skin complexion, these patches can appear in various shades, from brown and tan to pink, gray, black, or even purple. This condition occurs when skin cells produce an excess amount of melanin, which is the protein pigment that colors our skin and hair. Overproduction of melanin can be triggered by a range of factors, including hereditary influences, certain medical conditions, medications, and external influences like sun exposure. If your patches of hyperpigmentation are more than one color, it's important to have a doctor evaluate the site and possibly perform a skin biopsy. Hyperpigmentation comes in different varieties. You might recognize freckles, small tan or brown spots that often develop in childhood on sun-exposed skin and become darker and more numerous with sun exposure. Then there are age spots, or solar lentigines, which vary from tan to dark brown and are larger than freckles. They usually develop in adults due to sun exposure or previous sunburns. Another common type is melasma, which causes irregular dark patches on the face and can be triggered by both sun exposure and female hormonal influences. Maturational hyperpigmentation, which affects people with darker skin complexions, refers to the gradual darkening of sun-exposed skin due to chronic sun exposure or metabolic disease. There's also periorbital hyperpigmentation, or dark circles around the eyes, and acanthosis nigricans, a condition that causes skin darkening in areas that rub together, such as the armpits, groin, and back of the neck. Post-inflammatory hyperpigmentation is another type, where skin discoloration occurs due to skin inflammation or injury. So, how can hyperpigmentation be treated? Topical therapies are the most common first line of treatment. Since the most frequent cause of hyperpigmentation is sun exposure, using sunscreen daily and wearing sun-protective clothing is the best preventative measure. Over-the-counter topical remedies include products containing retinol, azelaic acid, vitamin C, vitamin B3, kojic acid, salicylic acid, glycolic acid, thiamidol, or arbutin. Certain vitamins and antioxidants, like vitamins A, B, C, and E, as well as natural oils like rosehip and argan oil, and extracts including turmeric, green tea, and licorice, may also help with skin brightening and inflammation. Other treatment options can include prescription lightening creams, chemical peels, laser therapies, and microneedling. However, always consult your doctor before beginning any new medication or treatment. If your hyperpigmentation is due to a medical condition, your doctor may be able to prescribe medications to help. Hyperpigmentation, while not harmful to your health, can be emotionally distressing. Understanding the causes and treatment options can empower you to take the necessary steps towards managing this condition. Remember, prevention is always better than cure, so take care of your skin by protecting it from the sun and treating it gently. It's never too late to start caring for your skin. Share to care.